Hello, everyone. Welcome to our webinar, COVID-19 and Higher Ed Update. Thank you so much for joining us today. My name is Sarah Porter, and I'm the Director of Healthy Green Schools and Colleges, a partnership between Healthy Schools Campaign and Green Seal. Formerly called Green Clean Schools, this program leverages more than a decade of Healthy Schools Campaign's work, along with Green Seal's additional expertise, providing even more resources for creating healthy, sustainable, and effective cleaning and facility management programs. Before we begin, I'm going to quickly review some basics for today's webinar. This webinar will run for approximately 1 hour, and a recording of the webinar will be available to view later. We will email you a link to the recording, and it will also be archived on the Healthy Green Schools and Colleges website. We're going to save the bulk of our time today for a question and answer session with our steering committee members. You can ask questions by typing a question into the questions box located on your control panel and clicking on the send button. Feel free to send questions through the questions box at any time during the presentations, and we will answer them during the Q&A session at the end. Throughout the webinar, you will also see a couple of poll questions. Each one will be a multiple choice question, and we'll give you about 10 seconds to choose a response. So keep an eye out and be ready to answer when the questions come up. As you all know, COVID-19 has completely changed the way schools and colleges are cleaned and maintained, and it looks like many of the changes the pandemic has caused are here to stay. As your custodial team reflects on lessons learned from August and September reopenings and prepares for the winter flu season ahead, we know that you have many questions and are looking for tools and resources to help guide you during this critical time. Today's webinar, the second in a series of 3 fall COVID-19 update webinars, is designed to help you with just that. We have a panel of 3 committee members from higher education institutions who will share an update on what they've learned since the beginning of the school year, including adjustments they've made, new challenges, and creative solutions. Before we hear from them, let's pause and launch our first poll question so that we can try to tailor a bit of today's content and future webinars to what you, our audience, are most interested in hearing about. On your screen, you see a multiple choice question. We'll leave this up there for about 10 seconds so you can respond. Have you had to make significant changes to hiring and staffing this school year? Go ahead and respond. Okay, we'll leave that up there for another 5 seconds. 3, 2, 1. Okay, let's see what folks had to say. So this is interesting. We had 36% of respondents said that they have hired new personnel for their custodial teams, 18% said they're struggling to find workers, and 45% have said that their staffing has remained the same. Well, I'm sure we'll get to talking more about staffing challenges later in the webinar, so thank you for sharing that information. Before we move on, please note the information shared during this webinar is for general informational purposes only. The experiences and information shared today are not intended to replace, directly supplement, or formally operationalize the guidance provided by the U.S. federal government, including recommendations published by the Centers for Disease Control, the Occupational Safety and Health Administration, and the U.S. Environmental Protection Agency. We encourage you to visit those federal agency web pages if you're seeking formal instruction on how to develop or update your cleaning protocols in response to COVID-19 or any public health emergency. We will include links to these resources in our follow-up email. Today's webinar is a knowledge sharing event in which the leaders of green cleaning and building operations in colleges and universities will share their experiences. On the webinar today, we have Christopher Rains, the Director of Administrative Services at Cosumnes River Community College in Sacramento, California, Aaron Uresti, the Assistant Director of Custodial and Housekeeping Services with the Facility Services Department at the University of California in Riverside, California, and Jean Woodard, the Director of the Building Services Department at the University of Washington in Seattle, Washington. First up, I'd like to introduce Chris Rains, the Director of Administrative Services at Cosumnes River Community College. Chris?
Thank you for having me here this morning. As you just introduced me, Chris Rains, Director of Administrative Services. To make that a little better understanding, it really means Director of Facilities and Campus Operations. They just decided to make me sound like I'm an administrator. I have 21 years experience in facility maintenance, working my way up through the custodial field all the way up to my current position, which I've had for the last 2 years. Everything was fairly normal and smooth in our lives until last March, when we got the curveball of generations, which triggered a lot of changing of what we're doing, and also reaffirming what we had been doing a lot across the board with certain protocols and things that needed to get put in place. Los Rios Community College District, they shut the campuses down, which one college of 4 inside of the Los Rios Community College District. So the campuses have been closed since March, with only essential employees entering the campus, which is sort of unique to my counterparts on the thing. They still have students and staff at a fairly high rate compared to what I have to put up with. But it has produced other challenges since the campus is closed, having protocols in place for allowing people that are not deemed essential to enter the campus. So we can have tracking protocols in place for if someone does show up that had been exposed but they didn't know it, we know where they were at and where they went when they were on campus. It assists the custodial department in knowing where to go clean the next day after people have entered the campus, which is greatly enhance what we're able to do for the various people that are coming on, to make sure they feel safe and secure when they're on campus. The other thing that we really had to flesh out and work on, because it's a little different than some of the other things that come up when someone gets hurt at work, the protocols for exposure notifications and how that is handled has been something that has been some retooling of how we handle notification of everyone when it's been done without violating any HIPAA rules in the process. It's been very interesting to do. Currently, what we have going on campus, we only have one building up and going, and it is for the labs for the first responders. So we have the ability to clean the buildings, really that one building particularly well right now, with the amount of custodians that we have sitting on the sidelines. This has only been in place since August. So we run through the process of when the class schedules are there, when we can get into the restrooms, all that process in place. And it was a little different, because what I needed to stress to everyone as we were going through this process was scalability. I didn't want everyone to get used to a certain level of commitment to the custodial staff with one building and 20 plus custodians not doing anything. We were able to do something that we can't do when we open back fully sometime in this coming summer. The other things that we've dealt with was the grounds department and having everyone getting upset that the campus is looking a certain way when no one's there doing the mowings and those things like that. Really not a part of cleaning, but it provides a certain look to the campus that people were concerned with. It was just an interesting period to go through for the last couple months on trying to get everyone that wants to work, but we can't work them because of the standard the district put down on keeping the campus closed to non-essential employees, with the small exception of the first responder classes, which is about 3 classes total. I think we're running out of, probably over 1,000 have been shut down. The other challenge that we had getting in place, and really challenges to get it up and going, was to get all of our protocols and fashions and things that we were doing up on the website, so people could actually see what we were doing and how we were doing it. Having the cleaning protocols out for people to read, how we are going to handle if there has been an exposure on the campus, getting that all up there where everyone can see it and it's been be viewed, was a bit of a lift, just because we had it all in there, but not we quickly posted and put in place. There were other things going on. It's just been an interesting time in the cleaning side of the world, on expressing to a lot of people around that a lot of things that we're already doing or they're wanting us to do, we were already taking care of. So the protocols for the custodials, wearing PPE and how to handle disinfectant, and if they were using an electrostatic spray or not, what were they using when they were doing it. A lot of those practices we already had in place. And we're going just clicking along with what we found. We just had to get it out there for everyone to see it and publish it so people can see it. That's the biggest advice I've always tell people on my side of the world, is what we do shouldn't be treated as a state secret. Get it out there, put it into writing, show what we're doing and how we're doing it. It helps on the back end far more than just saying we got it and not going into any details of how we got it. So it also does help, even though with the staff that have been highly trained, as a constant sort of just little reminder at the start of each shift that they have when they are rotating on to the 1 week on they have to take care of the first responder classes, on what the protocols are, how to follow them, what to do if this happens or that happens. The other thing I've stressed that we've been doing a pretty good job on is also those employees that aren't coming on a regular basis. Stay in contact, reach out to them, talk to them, see how they're doing, make sure nothing's going on in their lives, that there are certain protocols or things we have in place to give assistance if needed. Just being that you don't see them every day, I try to recommend to everybody to reach out and try to contact employees at least once every other week to see how things are going and what's going on. And that is kind of what we've been dealing with since March, on just trying to be open and open, but not open at the same time. Handing out Chromebooks and textbooks at the start of semester was an interesting process to go through with the college, because we didn't have that in place, of how we were going to socially distance and keep everybody safe while trying to hand somebody a textbook or a Chromebook, and making sure that they were the ones that were allotted that technology and or book. Was an interesting experience to do over the summer outside. As cars drive up, we kind of did an In-N-Out burger type situation where they just would drive up and we'd get their information and hand them what they needed to have. That was a interesting change in protocols and how we were normally doing things. So with that, I will turn it over to my next panelist.
Thanks, Chris, for sharing all of that. You said so much about especially transparency and communication with your larger school community, and also supporting your staff. So thank you. Thank you for sharing. I'm sure we'll have questions for you a little bit later. Next, I would like to introduce Erin Uresti, the Assistant Director of Custodial and Housekeeping Services with the Facility Services Department at the University of California in Riverside. Erin?
Thanks for the introduction, Sarah, and hello to everybody on the webinar. As Sarah mentioned, my name is Erin Uresti, Assistant Director of Custodial and Housekeeping for Facility Services at UC Riverside. I've been in the cleaning industry for 20 years, and the majority of my career has been spent working in higher education, managing cleaning operations. I can honestly say that I feel like I've probably done 2 years worth of work in the last 7 months, like probably most of you on the call. Our campus is one of 10 schools in the University of California school system, and we're located in Southern California, about 50 miles east of Los Angeles. We have about 25,000 students and 8,000 staff. Our custodial and housekeeping team is responsible for cleaning the majority of the academic and housing buildings, totaling about 6 million square feet of space across 200 buildings. We have a group of about 150 full-time custodians and 10 supervisors. So our custodial and housekeeping staff has been on campus working continuously since the pandemic began, as we never fully closed. We've been providing increased cleaning and disinfecting of high touch points in buildings where we still have critical research taking place. We spent the spring and summer months preparing our general assignment classrooms and housing buildings with the assumption that we were going to fully reopen for fall quarter, which started in late September. We also used this time to retrain our custodial staff on proper cleaning and disinfecting methods, such as cleaning visibly soiled areas first and following the proper dwell time of the products to ensure their efficacy. We've also had to make sure that our program followed the CDC's guidance for cleaning and disinfecting in schools. Well, unfortunately, fall reopening did not go as planned for us. Southern California counties continue to have infection rates that are above what the state requires to reopen schools. Just last week, our campus recently announced that the winter quarter, which runs from January through March, will be the same as the fall. In our academic buildings right now, administrative staff continue to work remotely, and the general assignment classrooms remain closed. About 40 rooms, which are mainly teaching labs and art studios, were open for in-person instruction with very limited capacity. These rooms are averaging about 1 to 3 times a week of use. And our custodial staff is responsible for cleaning and disinfecting each room nightly after instruction takes place. We've also installed hand sanitizer dispensers to promote good hygiene practices in these rooms, as well as in building entrances. And we're supplying and replenishing disinfectant spray bottles and disinfectant wipes in the rooms so that faculty and students can clean their workspaces throughout the day. One thing we're also doing is we're providing disinfecting kits to departments that have returned to campus in some capacity. The kits contain a hand sanitizer and an alcohol-based disinfectant that does not require PPE if they wish to clean their workspaces between our scheduled cleanings. Our department also created an informational webpage for returning to campus that provides information on our service levels and how to order additional supplies and PPE from our vendor partners. We continue to conduct enhanced cleaning and disinfecting of public spaces and restrooms throughout our academic buildings multiple times a day where we have activity. And we're also able to do deep cleaning and some project work to prepare for the time that the campus fully reopens. We've also had to adjust our work schedules from 5 days to 7 days a week in an effort to reduce large numbers of custodians on the same shift and minimize large gatherings. In our housing areas, contract numbers declined throughout the summer to where we finally landed at an occupancy rate of about 30%. Although this resulted in the closure of several buildings, we were able to keep our entire housekeeping staff employed by creating an enhanced cleaning program for our residence halls. Essentially, we moved from a 5-day-a-week, 8 hours a day operation to a 7-day-a-week program where we have housekeeping staff on site for 12 hours a day. New shifts were assigned based on seniority, and tasks such as restroom cleaning in the residence halls have increased from 1 to 3 times a day. And this also includes electrostatic spraying of high touch points between routine cleaning and disinfecting periods. The public spaces such as study lounges and music rooms remain open with limited capacity. And we're also providing disinfectant spray bottles and wipes in these areas so that residents can assist by cleaning these spaces before and after each use. One thing I wanted to point out was that the pandemic has caused us to reevaluate our chemical choices, specifically with disinfectants. We wanted to choose products that we felt would provide a safer alternative to disinfecting and protect the health and safety of our staff and the campus community. We selected products that are on the EPA's list N for effective use against SARS-CoV-2 that contain ingredients like alcohol, hydrogen peroxide, and citric acid. We were able to select safer disinfectants that did not compromise effectiveness or dwell time. So in closing, as we continue to move through the pandemic and prepare for the campus fully reopening, we're constantly making adjustments. Budget constraints and staffing challenges are a couple of things that come to mind. We're doing more with less. Our department is under hiring freeze where we are unable to recruit and hire for several vacant positions within our group. We're always moving staff around to cover areas where an employee might be out for an extended period of time. We used to have the ability to hire temporary employees for these situations, but that is no longer an option. Unfortunately, we're bracing for potential budget cuts that could lead to furloughs, layoffs, and reductions in service. We're working hard to show the value of our program and the importance that we have in cleaning for health on our campus. We also continue to focus on the morale of our staff by keeping them informed and engaged in our program, reminding them of the importance of their role as an essential worker and recognizing them for their efforts. As we all know, the pandemic situation that we've been facing over the past 7 months has been very unpredictable, with changes happening on a daily basis. That's all I have for you today. Thank you for your time, and I hope that everybody's staying safe.
Thank you, Aaron. You shared so much in a pretty short amount of time. I appreciate you sharing some of the detail on how you adjusted your staffing schedules from 5 days to 7 days. And also your last point about reevaluating your disinfectants and choosing ones that are the safer alternatives, I think is an important one. I just shared in the chat box a link to a guide that Healthy Green Schools and Colleges put together, are guidelines for COVID-19 cleaning and disinfection. This was created specifically for schools and was written with in partnership with the environmental scientists at Green Seal and input also from our steering committee members. So if you all haven't had a chance to take a look at that, check out that link. There's some really good resources there. Before we move on to our final speaker, we're going to do one more poll question. So this will work the same as before. You see a question on your screen. Have you invested in new disinfection products and equipment this school year? So take a moment and please choose a response. Okay, we'll leave this up there for another 5 seconds. 3, 2, 1. Okay, let's see what everyone had to say. Okay, so 29% of respondents said that they're using a new product. 64% shared that they're using a new product and new equipment to apply it, and 7% said that they were using the same disinfectants. This is helpful information, and if you, for those of you listening, if you're willing to share more information, go ahead and use the questions box to tell us a little bit more specifically. If you're using a new product and equipment, why did you need to make a change? If you didn't, why not? Any additional information that you're able to share will help us sort of customize the programming that we do going forward. So would definitely love to hear a little bit more detail from you. Use the question box to tell us more. And also, if you haven't already, start populating that with questions for our speakers. You don't have to wait till the end. You can start to put them in there now. And we are going to move on and introduce our final speaker. Please welcome Jean Woodard, the Director of Building Services with the, excuse me, Jean, the Director of Building Services Department at the University of Washington in Seattle. Welcome, Jean.
Thank you, Sarah. It's good to be here this morning. I've been at the university for 35 years, and for the last 8 months, it feels like I've been drinking out of a fire hose consistently. It's been a really busy, changing time, high anxiety time. Our department has certainly been elevated in importance and is viewed as important. We always were, but it's even more so now. To address the disinfecting question, since it was just up there, we were using a quat disinfectant, and once we started doing more enhanced disinfecting, and people were using the quat longer during the course of the day, we wanted to go with something milder that was less of a respiratory irritant. So we switched over to a hydrogen peroxide product, and we also purchased, although it took us from March until September to actually source them, but electrostatic sprayers. So those are two of the changes that we've made. Building services is composed of 2 units, the custodial services department, roughly 290 custodians and 7 different geographical work areas, and UW Recycling, and we champion the university's waste diversion efforts, manage all the waste disposal contracts, as well as we have an in-house team of waste collectors. We're fairly unique, I think. We do most of our cleaning, 90% of our cleaning during the daytime, 5 a.m. to 1:30. So my staff has been well connected to the university community. As a result, they're part of each department. We have well-established green cleaning programs, and we've been cleaning for health using all the PPE. And our staff understands that what they're disinfecting is removing the things that are pathogens that the naked eye can't see. The university is the flagship university for the state of Washington, a research university, over 300 special research centers. That was part of our problem. We really didn't know where the research was taking place on campus after the campus closed. We have approximately 13 million square feet that we're responsible for. Previous to COVID, my staff was very productive, 44,000 square feet per custodian. And we have a self-service for offices, so we would only go into offices once a week. There are typically 44,000 students on campus. When this first started, my department, UW Facilities, our mother department, we established 3 objectives. And the first was to help flatten the curve in the Seattle community, the spread of the virus. The second was the safety of our essential employees who were still coming to work. And the third was providing meaningful work for our essential workers, our frontline staff. So to help flatten the curve, initially we modified our work schedules. We rotated people to campus and working at home. They would work on site for 2 days a week, at home 3 days a week, on site 3 days a week, at home 2 days a week. And so we did that from March through June. And in June, we brought everyone back full time, but at the same time, we offered voluntary furloughs to individuals who either were concerned about being on campus, had underlying health conditions, or were over the age of 65. So initially, we placed 54 people on voluntary furlough at that time, and currently we have about 35 to 40 people who are still on a voluntary furlough. We developed what we called return to work plans, very specific, but we were already here. We never left, but we modified all of our clock stations. We added different clock stations so that our staff could clock in and out, get their keys, and remain physically distanced. We have directional arrows everywhere, floor decals for where people are to stand and wait. We disinfect the keys. Any common touch points are continuously throughout the day for our staff. And we began providing surgical masks when they became available. And we issued 2 reusable cloth masks to everyone who was coming on site. During this time, we also provided 3 different COVID prevention training sessions. One was by our training specialists within facilities, and this was on the soft skills and anticipating students coming back and our staff cleaning in others' workspaces and being around the students, faculty, and staff, we wanted to give them the tools to be able to graciously and politely ask someone not to enter a space while they're cleaning it, or to maintain their 6-foot bubble. The other training was more technical, just on all the attestations. Everyone has to attest that they have no symptoms each day. We have protocols for when someone is, a family member is tested positive or suspected of being positive. So we trained everybody in all these protocols that were developed by our EH&S department and in partnership with facilities. And we also provided occupational physician came in and recorded a video and presented to all of our staff, 10 people or less. So she recorded this so she could maintain her voice. And it just illustrated how the virus is transmitted. There was a couple of videos in there. And this has really helped our staff feel that they've been cared for, that they're providing all the necessary education and resources to keep themselves safe while at work. There have been a number of challenges in preparing for the fall. Initially, we thought that there might even be a spring quarter back in March. That was quickly canceled, and the university went to 100% remote learning. There's still research taking place and just a few other essential people coming to campus during that time. So we developed, we've actually developing our 5th plan. Our first plan was to deep clean and disinfect all of the academic spaces, auditoriums, lecture halls, and just deep clean and sanitize every space. We did that for 2 months. Then we did a one-time deep cleaning and disinfecting of departmental space, break rooms, conference rooms, offices. The third plan was to do floor work that we haven't been able to do in decades. So the campus is cleaner now than it's ever been, providing this meaningful work. And our plan for the fall quarter was to provide for in between classes disinfecting. We worked very closely with our academic, technology, and services department, where they scheduled classes that were going to have a 1-hour break between the classes to allow us to go in with the electrostatic sprayers and disinfect the touch points. All these learning spaces had all the physical distancing symbols and decals and directional arrows and where to sit, hand sanitizer, disinfecting, gloves, and masks, just in case students or forgot their mask. There were going to be 50 buildings holding classes. That's down now. It ended up being less than 10 buildings. We established a new work shift and some people jumped at the chance to transfer to a 7:30 to 4 p.m. shift. Most of our team works 5 a.m. to 1:30, but we established this shift so that we can clean the afternoon classes in between the afternoon classes. There were 70 originally scheduled. Actually, there's 6 now that are taking place. So we're going to revert that shift back to their previous schedules because our winter quarter appears to be on the same trajectory. It's going to be the same level of people on campus, probably the same number of classes. We probably won't expect to have more in-person classes until next fall quarter. Some of the challenges that we faced were sourcing hand sanitizer stands early on. We were obligated to place hand sanitizers at every entranceway. And from H1N1, we had about 80 of these out there, but we needed far more. And so we ended up getting the liquid type. That was all we could source at one point. And that hasn't, they leak, and we've been having some difficulty with those. We've also had difficulty with students adhering to the mask wearing policies. The university, the students living in our resident halls are doing great. There's very few cases, but we've had an outbreak of cases with the sororities and fraternities. There's like over 300 cases just since the end of September. And so very few cases have been attributed, or I don't think there's been any cases actually that have been attributed to being contacted here on campus. So I think I'm getting close to being out of time. You know, we're continuing to try to provide meaningful work. We will have budget reactions. We've been under a hiring freeze since March. We can now do some selective hiring, but we're anticipating future budget concerns as we move forward. So thank you very much.
Thank you, Gene. You shared so many really important and helpful things, and I think it's remarkable what you just said about not having any cases that were attributed to contracting them on campus, which is remarkable given sort of where you are geographically and how you were kind of right in the epicenter of the early wave. So really commend you and your team for doing an amazing job there. We are going to move on to our Q&A session. So if you haven't already, please go ahead and share your questions in the questions box. We've got a number of them already, but go ahead and definitely continue to add there. And we'll use the rest of our time to address as many as we can. So we are going, my first question, so Gene, you talked about this right at the beginning of your remarks, but I want to kick this question back to Chris and Aaron, really stemming from that poll question we asked. I'd love to hear more about any changes that were made to the products and our equipment that you're using to disinfect. So Gene, you talked about that, but Chris, could you talk about whether or not there were any changes that you used in your program? I know you're in a bit of a different situation because you've not reopened in the same way, but have you switched your plans at all?
We hadn't really switched our plans. We were going towards the sustainable on-site generating cleaning prior to the COVID outbreak, so that's still moving forward. We did purchase a couple of electrostatic sprayers for the locations where the essential employees that were still coming on campus visit each day, the IT building, the police office location where the employees are still visiting. We purchased that. So that's the only augmentation that we've done that we didn't have in place, although there was plans to put that online. Without COVID happening or not, we were still going to get some eventually. So it was just something that got accelerated.
Thanks for sharing, Chris. Aaron, is there anything you'd want to add about your program?
Yeah, pretty similar to what Gene was saying. We were using a quaternary disinfectant for routine disinfecting before the pandemic, and you know, kind of looking at the higher frequency of disinfecting that we were going to be undergoing, we wanted to go with something that was going to be a little bit less harsh, less of a hazard to our staff and the campus. We're also providing disinfectants to departments that are returning. So the combination of both of those factors and trying to find something where we didn't have to provide PPE to campus departments kind of caused us to make these switches for the better. I think that this is something that we were looking at doing down the road anyhow, but moving to a hydrogen peroxide-based disinfectant for our staff on a routine basis is something that we're doing now. We're phasing out the quaternary disinfectant that we have, and then providing the campus with an alcohol-based disinfectant that does not require any hand or eye protection worked out really well for us. And we're also incorporating electrostatic sprayers into our enhanced cleaning, disinfecting of high touch points. And with that equipment, we're using a botanical-based disinfectant.
Thanks, Aaron. The next question, I'm going to give you each a chance to answer this. But have any of you invested in technology to assist with staff routing, traffic patterns, or cleaning task tracking? Jean, I'm going to ask you to respond first.
We didn't invest in any new or additional technology during this time frame. We do have a work management software program that we employ for assigning staff and space management and just knowing what the room types are on campus, but nothing new during this time.
Okay, thanks. Chris or Aaron, either of you?
We have not,
Okay, Chris.
although I have looked at some for the simple fact that I'm wanting the ability to provide documentation that the custodians have done what we asked them to do, more for their protection than me not trusting them. It's more to be able to give to someone above me in the chain of command to show that the custodial staff is doing what is being asked of them when asked of it. So that's where I've been dabbling with looking at them.
Thanks, Chris. That's so in line with what you shared earlier about transparency and documentation.
Yep.
Aaron, go ahead.
Yeah, so for us, didn't add anything new or additional. We already have a custodial management software program in place that we utilize for quality assurance, and there is a workloading function that we also utilize it for. We're probably going to need to use the workloading function a lot more as we move forward, as I kind of mentioned before. There's going to be some changes to our service levels in the future as far as frequencies and unfortunately probably lower frequencies. So we do have the right tools to do that and figure that type of workload out for our employees.
Thanks, Aaron. The next question is, and some of you touched on this a bit, but I'm going to ask you to be a little bit more specific about exactly what your protocol is when you have a confirmed case, both in sort of what do you do with that physical space, and then what's the protocol for communicating out. Jean?
Very good question. Our protocols have evolved as the science and information has changed during the course of this last 8 months. We have hired 4 contact tracers that are full-time and work with our environmental health and safety department. If an individual is confirmed as positive, we usually learn about it days after they've been on campus. And the most important safety factor for me and my team was that we would wait as long as we could before we would enter the spaces where the individual spent more than 10 or 15 minutes. And then we would go in with our gowns, gloves, electrostatic sprayers, or the hydrogen peroxide. We would have a sign on the room saying closed for disinfecting. We put a sign back up when it was completely disinfected. And as time has gone on and we've been able to develop our enhanced disinfecting, where we're disinfecting spaces 2 and 3 times a day, several decisions have been made that we do not need to deep clean a space because a person was there 7 or 8 days ago or 5 days ago, and we've already been in that space and performed the enhanced disinfecting. So that's been a great help. The contact tracers interview each individual. They're quarantined, or we have resident hall rooms that are for students, where they can be quarantined or isolated for 14 days. And we notify anyone who is in the building, just out of transparency, that there is a positive case, while keeping the confidentiality of the individual who tested positive. So we get a lot of those notices because our custodians are in the buildings where faculty and staff and research is taking place. And so that's pretty much in a high level view of our protocol.
Thanks, Jean. Erin, is there anything you'd like to add about your protocols?
Yeah, so we have a couple different protocols in place, and kind of as Jean alluded to, they've definitely evolved over the last several months. In our housing areas, if we have a confirmed case, the student is moved to a quarantine area where we have several rooms prepared for the individual to go into a quarantine situation for up to 14 days. In our academic areas, if there's a confirmed case, and if the space can be cleaned, the space can wait to be cleaned for 7 days, then our custodial staff will go in and do our regular cleaning and disinfecting of the space. If it's a situation where the space needs to be cleaned before 7 days, then we're working with a third party right now to do that work. Potentially something that we're looking at down the road is bringing that service in-house to do, I guess at that point, it's a decontamination situation where you need to clean the space before 7 days and wear a little bit different PPE and a different process.
Great, thanks, Erin. Chris, anything you'd like to share on that question?
Yeah, I have the luxury of not having people live on campus, so I've yet to have a exposure that has happened that the room hasn't been able to be shut down for a 2-week period. So as an example of the EMT class, their lab sessions actually have the students out in the fields with the EMTs. They get exposed. The entire class gets shut down for 2 weeks. It's just not the student that gets sent home for 2 weeks. The entire class gets sent home for 2 weeks. So then there's no reason to send custodians in because no one's going to be in that room for a 2-week period right away. So we usually wait a week and then go in and do what Erin said on a general cleaning after an extended period of time and move forward from there. We do have a protocol in place if it is a room that is used by another group that has not been shut down. But the likelihood, if that were to happen on the one room we have where it's multiple classes are using, I suspect strongly that both classes would get shut down at that time, and the same place protocol would be in place on waiting to go in.
Thanks, Chris. Our next question, I know, Chris, you touched on this a little bit. Jean, you shared, I especially was interested in the training you talked about for soft skills to support staff and sort of how they go about and are able to communicate with folks as they're doing their work. This is such a strange and different time. I'm curious about other ways that you all have focused on really supporting your staff during this challenging time, given the challenging work that they're doing. Is there anything you'd like to share that you haven't already mentioned? So Erin, I'll ask you first.
No, just kind of as I mentioned at the conclusion of my piece, we're really working hard to keep the staff informed and engaged in what we're doing and the reasons why we're doing it. Especially with the shift changes that we had to make. That was a challenge in itself, just trying to you're ultimately changing people's lives, right? So you're taking somebody that might be accustomed to working at a certain time of day and having to move into another, and explaining the reasons why we had to do that and to try to space everybody out a little bit better. That's been very important to us, and it's been something that I think our supervisors have done a really great job with doing, and explaining the reasons why we're cleaning a certain building at a certain time of day, and the like.
Thanks, Aaron. Chris, anything you want to add?
Going back to, I said, just keeping everyone informed when you see a custodian you haven't seen in a while. Stop, have a chat with them. Ask them how the family's doing. Give them any budget updates you can give them. My end of the world, everyone's a little skittish because they're sitting at home getting paid, but they're not doing anything. So everyone gets worried that this isn't going to go on forever. Or they're gonna lay us off, and explaining how the budget process works with the state and what that means and how it affects them and all that. And just again, the most information you can give is greatly needed, because again, information is like sunlight on a germs. It'll kill it. It'll get rid of the angst and the all the inside the head stuff that people will start sometimes. You just got to reach out and talk to them as often as you can, and share the information you have on what has the potential of affecting them. So sort of like an evaluation process, there's no surprises. Put the information out there so they're not shocked and blindsided by something if something were to come up.
Thanks, Chris. And Jean, you definitely shared some on this already. Do you have anything you want to add?
Yes, we similar to what Chris said, the communication. I meet with my leadership team twice a week, and there's always a part of the agenda on what is to be passed along to our entire staff. I've created 2 videos describing how we clean. One was early on, how we were deep cleaning and disinfecting the campus. This was both an external and internally focused video. And then our Dr. Milik, the physician that we employ, just recorded a 5-minute video that we're going to share with our staff. And it just talks about focusing on the precautions we need to take as the winter season comes, reminding people this is the time to take the flu shot if you haven't, what to do with family gatherings. So it's just a really good advice there. The university has formed an employee emergency fund for any employees who've been financially impacted by COVID. Some of my team members have qualified for grants from that fund. We're continuing with the fundraiser to keep that fund viable. And we also are just now getting to the point where we're comfortable enough to have a recognition event. We normally have a departmental-wide recognition event. We set funds aside for that program. It's usually in September. So we're going to do it in a physically distant way in smaller groups, but we're going to be having box lunches, individually wrapped. Hopefully we can eat outside if the weather permits, but we'll just to show our appreciation to staff. And I've been getting out, trying to visit staff just to see how they're doing, ask about their families, are they feeling safe, just to try to stay in touch. But that's been the thing I've missed the most about during this last 8 months is we were highly engaged with all of our teams, and that has really been impacted with the physical distancing and the COVID. But we're trying to stay in touch as best we can.
Thanks for sharing all of that, Jean. Lots of great ideas there. We are nearing the end of our time. We're going to try to get to 2 more questions. The first one, Jean, I'm going to stick with you. Is your university providing any quarantine or isolation housing?
Yes, there's been 2 resident halls, relatively new, that have the potential to house 900 isolations or quarantine students. So far, the utilization there has been like 0.2%. It's only been 1 or 2 students that have been isolated at a time. And this has been the students who live on campus. And just last week, we offered to the sororities and the fraternities and the students who live in apartments the ability for them to use these isolation rooms as well, obviously at a charge, but that's, we do have that in place.
Great, thanks, Jean. And our last question, I'll ask you each to answer this one quickly. Can you share sort of at this moment looking forward, what's your greatest challenge? And do you have a plan about how you're going to approach it? Chris?
Reopening of the site and the pinch points that will come from that with having everything shut down for so long and not used. Use an example of the athletic fields haven't been mowed since March. So for them to start outside sports with very little notice, it's almost an impossibility. So it's restarting of the facility to bring everybody back. I think will be the biggest challenge I have going forward, and reassuring everyone that it's a clean, healthy facility as they come out of the hibernation mode that they've been in.
Thanks, Chris. Aaron, I'll ask you the same question. Greatest challenge?
I think the greatest challenge for us will be what our future holds as far as what our program's going to look like after any potential budget reductions. We have a great program in place. We're really working hard to disinfect and do enhanced cleaning of high touch points. But you know, when the campus does fully reopen, it's going to be a challenge for us with some of the things I pointed out, where, you know, having to move staff around for coverage purposes, you know, not being able to have that support of temporary staffing. So we're crossing our fingers, but we hope it'll be less of an impact on us going forward.
Thanks, Aaron. And Jean?
The biggest challenge I'm faced with right now is developing a long-term strategy to keep my employees gainfully employed, and having meaningful work to do. We're now looking into investing in upholstery cleaning equipment and carpet cleaning equipment, so we can go through the entire campus doing that for the autumn, winter quarter. At some point, we'll run out of projects, and I don't think the campus will ramp back up. So as people are retiring or resigning for whatever reason, we're not filling those positions. So that's my biggest challenge, just the long-term impacts the pandemic is having on our state economy and our state budget, and we're a state-funded university, and that funding is probably going to be decreased over time.
Thanks, Jean. And thank you, Chris and Aaron, all of you, for sharing your experiences with us today, and for everyone listening for making time to join our webinar in this important discussion. My contact information will be on the screen in a second. I also, before we adjourn, want to take a moment to thank our program sponsors who this program would not be possible without their support. And so I want to share the list of them here, and especially thank our platinum sponsors, Diversity, Georgia Pacific, and Gojo, which is the makers of Purell, and all of our Healthy Green Schools and Colleges sponsors for their support. So thank you all. I mentioned earlier that this is the second in a 3-part series. Our final webinar will be on Thursday, and we'll focus on diving into a little bit more detail on some of the most commonly asked questions from the first 2. So if there's something you want to hear more about but haven't asked, it's not too late to send that in the questions box, and we'll be sure to take a look at it and see if we can make sure to cover it on Thursday. And last thing is that I want to make sure that you, if you're looking for more guidance, that we have information and an opportunity to attend our virtual programming on the topic of safe and healthy schools. You're going to want to register for the virtual ISSA show in November. This live virtual event will feature more in-depth panels like the one you heard today, and on COVID-19 challenges and other topics related to schools and universities. It's going to be November 16th to 19th, with at least one live virtual session each day. So you can learn more and register for that event at healthyggreenschools.org/ISSA. And a final reminder that we're going to be sending out an email with a link to the recorded webinar today with more resources too. So thank you all for joining us today and have a great afternoon.